It's important that we know what we mean by mindfulness. Often when we meet patients who are living with pain for quite a long time, they'll have heard about mindfulness in one context or another. From our point of view, a definition given by Jon Kabat-Zinn, one of the proponents of mindfulness, that it means paying attention in a particular way, on purpose, in the present moment, and non-judgmentally. This does not mean relaxation. In fact, one of the goals of mindfulness is to become more aware rather than more relaxed. Of course, if the side effect is relaxation and you struggle with persistent pain, then that is often experienced as helpful. Mindfulness actually refers to 4 different but interrelated skills. These are connecting to the present, task-focused attention, cognitive diffusion, and sensation tolerance. So why is it important to know and practice mindfulness in the context of pain management? Well, it's one of the pillars of pain management and our model here at Chelsea and Westminster, and it's a component of our main psychological modality, acceptance and commitment therapy. In fact, mindfulness is the bridge between 2 areas of that model, between being aware and being open to one's experience. More specifically, practicing mindfulness helps people to connect to the present moment. People who live with persistent pain can sometimes become entangled with thoughts about the past. I'm not the person I used to be. Things aren't the same as they were. Or they find themselves fused to thoughts about the future. My future is bleak. It's hopeless. I'm going to end up in a wheelchair. Quite often these thoughts can lead people to feeling quite desperate, quite anxious, quite low. Practicing mindfulness is a tool for people to connect with the present moment. Mindfulness also helps with people's task-focused attention. Quite naturally, an experience of pain calls for our attention, and this can be difficult for people if that attention is constantly turned on. Mindfulness as a skill helps people to unhook from that attention and turn their focus onto things that are important in their lives. Mindfulness also helps with a process in psychology called cognitive diffusion. Quite naturally, we as human beings experience our thoughts as very close to us. However, if these thoughts are very difficult and they feel very fused to us and we feel very entangled in them, then they can often lead us to unhelpful behaviors. Mindfulness promotes this idea that our thoughts are just thoughts and that they can come and they can go. Finally, mindfulness helps people with sensation tolerance. When living with a persistent pain problem, quite often people fall into habits of behavior, responding and reacting to their pain unhelpfully. This might be grabbing a painful area, kneading it, avoiding moving in case one provokes pain, or overly rubbing the area. Using mindfulness as a skill to notice this behavior and then choose how one's going to respond rather than feel like one is stuck in reacting. So what does mindfulness look like here at Chelsea and Westminster in our pain management team? Well, the mindfulness practices are a key component of our pain management programs. We teach formal practices, including mindfulness of breath, a mindful body scan, mindfulness with the 5 senses, mindfulness using leaves on a stream, mindful eating, and mindful movement. Mindfulness is also a key component of the exercises that we use here in our pain management programs, including yoga, Tai Chi, and Pilates. It is also a key concept that we return to time and time again, whether we're in the gym with people or in the group room doing psychological exercises. If you want to find out more about mindfulness, I'd recommend the books by Jon Kabat-Zinn, Full Catastrophe Living, and wherever you go, there you are. You can also access our mindfulness audios by going to our website or going to our YouTube channel. Or you can go to www.fullcatastrophe.com freemindfulness.org for many free downloadable resources.